Welcome, everyone, to another exciting episode of Let's Talk. I'm your host, Peg Bolgioni, and today we've got an episode you won't want to miss. This podcast is brought to you by the Southern Vermont Area Health Education Center, AHEC. And if this is your first time tuning in, AHECs are national nonprofit organizations committed to strengthening and supporting our health workforce, especially in rural and underserved areas. In today's episode, we're diving into the vital role AHECs play both nationally and regionally as we gear up to celebrate National AHEC Week in late March. We'll be exploring how AHECs have been crucial to improving the quality, supply, distribution, and retention of health professionals for over 50 years. I'm thrilled to be joined by two incredible AHEC professionals, Dwain Harris, CEO of the National AHEC organization, and Nicole LaPointe, Executive Director of the Northern Vermont Area Health Education Center, AHEC, in St. Johnsbury, Vermont. Together, we'll discuss how AHECs are staying true to their mission and adapting to the ever-evolving needs of today's health workforce. So let's settle in for what promises to be a truly fascinating conversation. Both of you, welcome to the show.
Thank you so much, Peg.
Thank you, Peg.
So I think we'll just start. Dwain, could you tell us a little about your journey to NAO and your background and how you got involved with AHEC?
Sure, happy to, Peg, and thank you for inviting us to be on your show. You do great work with this podcast, and it's just a pleasure to be here. And yes, I've been with NAO as the CEO for a little bit more than 6 years. I started out after college in community journalism, and after a few years transitioned to helping a rural hospital system with some communications work. And from there, I got a little more involved in the administrative part of the hospital and obtained my master's in health administration. Soon after that, I was just looking and I saw an ad for something called an AHEC, and was not familiar with the acronym or what AHECs do, but was fascinated by the way in which AHECs appeared to be situated within their communities and as sort of connection points between academia and their communities. And so I applied and was fortunate enough to be the director of the Southern Kentucky AHEC in Mount Vernon, Kentucky, for about 15 years. I started in 2004, and in 2019 transitioned to this role with NAO. This is a virtual role, so I'm still in Kentucky, and we have a small staff of 5 total. Most are part-time. I am full-time, and we are happy to serve the broader AHEC network across the nation.
Okay, terrific, Dwain. And I will return the compliment. I have had the pleasure of working with you for the last several years since I've joined AHEC, and it's been a pleasure for sure. And you've done a tremendous job elevating the awareness of the organization. So with that, Nicole, can you provide us with your own history with AHEC?
Yeah, absolutely. And I just want to echo, Peg, I agree. The National AHEC organization is a terrific resource, has wonderful information about the work that we do and its impact nationwide. I'm delighted to be here to celebrate National AHEC Week. My background is a little different. I came from a social work background and became involved in public health because I was interested in how the amelioration of health disparities can also contribute to the reduction in social and economic disparities and raise whole communities. So I worked in public health for several years and then became the director of the Northern New Hampshire AHEC in 2005, which was under the umbrella of a larger organization, the North Country Health Consortium, which worked to improve public health across northern New Hampshire. And then in 2009, I became the executive director of the Northern Vermont AHEC, and I have been here ever since. I feel like there's so much to learn as within AHEC at the intersection of education and healthcare and workforce development provides so much rich material as a professional to grow into and track and follow and build from, that it's just been every year is something new, I feel like, working in the AHEC.
Well, that's excellent, Nicole, and I totally agree with you. Dwain, did you have anything you wanted to comment about that?
Oh, I just agree. I love the phrasing of being at the intersection of healthcare, and education and community development. That positioning enables AHECs to make a sort of a unique kind of difference for their communities. And I think that is one of the main things that is attractive about working for AHECs, just to be fortunate enough to sit in that position where you can make such a difference in so many different ways for your community.
For our listeners who may not be familiar, could you both explain what AHECs are and what role they play in healthcare and community development? What's the historical significance of these centers? Dwain, you can start by sharing about AHEC on a global level. And of course, Nicole, you can drill down to the regional centers in Vermont.
Sure, Peg. For those who may not be familiar, AHEC stands for Area Health Education Center, and they were developed in the early 1970s. We are a federal program conceived as sort of extensions of medical schools, just as a way to get some of the training of health profession students in more outlying and underserved areas. The AHEC mission is to essentially try to align the healthcare workforce with the communities that each AHEC serves. And many may not be familiar with AHECs because in some ways we work behind the scenes. We provide that training and that support that helps to support that workforce that is so important to all of us, really, in our respective communities. So AHECs have been sort of a part of that rural healthcare workforce, I guess, education infrastructure for a long time. And the work that AHECs do sort of manifests itself in a few different ways. AHECs coordinate student clinical rotations, and they do health career pathway work in which they sort of shepherd young students along their pathway to a health career. Many AHECs engage in continuing education work, providing that education for the healthcare professionals in their communities. And then AHECs just often more generally work as community partners in ways that improve that community's health. So AHECs are just sort of designed to be good partners, and the way that they're situated within each community, again, puts them in that great position to make that difference on many levels and through many different partnerships. A few statistics for you, Peg. There are AHECs in 44 states currently and several U.S. territories. And just some data from the latest academic year, there were 685,000 total participants in AHEC programs nationwide in 2023-24, 270,000 pathway participants, and AHECs facilitated more than 30,000 clinical training rotations. And there were 376,000 CE participants in AHEC programs last year, as well as nearly 8,000 AHEC scholars. So the AHEC program is the reach is broad, and we affect the health of our communities in many ways. And yes, we'll be interested also just to hear the perspective of Nicole, because each AHEC, because AHECs are designed to be responsive to the unique needs of their communities, each AHEC may look a little different in terms of the services that it provides. So, Nicole?
Yeah, that's a great intro, Dwayne. And thanks for spelling out Area Health Education Center. The jargon becomes second nature, right? And we all know internally what AHECs are. So the AHEC model is expressed in Vermont uniquely. The model is expressed differently in different states, but here our academic partner is the Office of Primary Care and AHEC program at the Larner College of Medicine at UVM. And what Dwayne was expressing about connecting the expertise and the resources of those academic centers to rural and underserved communities is done by expanding the network to regional centers. And in Vermont, there are two. Northern Vermont AHEC in St. Johnsbury, and Southern Vermont AHEC is located in Springfield. And the role of the regional centers are to engage local partners in the local health systems. One of the great advantages of facilitating those clinical rotations and the community-based learning experiences for health professionals is that we're able to connect with our academic partner and bring health profession students into rural and underserved communities to see how rural health systems function, to explore what it would be like to work in a rural hospital or in a rural provider setting. One of the things that I quote all the time is that research has demonstrated that people who are either raised in or educated, have a positive educational experience in a rural or underserved community, are more likely to practice in a similar community when they become a licensed health professional. So bringing those students out of sort of the greater Burlington area into our underserved communities is a great way to introduce them to what rural practice can look like and what it can look like to live and work in the beautiful communities in Vermont. For that same reason, we also work with younger students who are growing up in underserved communities, medically underserved communities and rural communities, and help them to navigate their pathways into health professions. And that can be complicated. There are a lot of different ways to get from A to Z. There's a lot of different ways to get to the health career that someone might aspire to, and there are more opportunities in the healthcare sector than most students can imagine. So we introduce them to what it feels like, what it looks like, what the skills are that are required to work in different high demand professions that have a lot of growth opportunities, and then support them to explore the different pathways to get there. And all of that is possible because we're connected with our local schools, we're connected with our local healthcare providers. We know what the needs are at all levels of health professions, and we understand what the training opportunities are, not only in our local colleges and universities, but also the pathways that exist within the healthcare systems, the hospital-sponsored education pathways, and things of that nature. So that's how we function out in the community to meet the aims and the mission of the area health education centers.
Well, that is beautifully stated, Nicole. Dwayne, did you have any other comments on what Nicole has shared?
Oh, just to compliment her on the great work that her AHEC does. You can tell from her answer that, AHECs, again, are sort of built to tailor to their communities, to be very intentional about the partnerships that they form, and the work that they do, keeping that end goal in mind in the case of, say, pathway programs. exposing those kids, particularly in rural and underserved areas, uh, to to the sort of pipeline that can lead to a health career, just showing them the different options that are out there, and then um, on down the continuum, providing hands-on opportunities for them to learn and explore and get an even deeper understanding of the health career options that are out there. And so, yes, I was obviously, as someone who works with the entire network, I learn about what each of our AHECs do, and am aware of the great work that goes on in Vermont. But it's so nice to hear from Nicole in terms of that more in-depth sort of description of what her AHEC is doing for their community.
What I'm particularly impressed with, as as I have been part of AHEC for several years, is as you have stated, Nicole, and Dwayne, you touched on the number of health careers options that are available to students right now. I don't think people even realize what's out there. And I'm so glad that AHECs are, I hate to say the word beating the drum, but we're continuously promoting that it is something that students, and I like the idea that it's inclusive,
Mm,
that all students have access to these programs.
agreed.
And so, Dwayne, we're approaching National AHEC Week, which is going to be held from March 24th through the 28th. And can you share what this year's theme will be and how NAO plans to promote it nationwide?
Sure, the theme is basically a rephrasing of our mission, which is strengthening the nation's healthcare workforce. And so we'll be promoting from the NAO directly through our social media channels, et cetera. And we're providing resources to the AHEC network, things such as sample proclamations for those AHECs who may want to approach their state or local governments to proclaim National AHEC Week within their community or their state. We're providing advocacy toolkits. The AHEC network has always been good at advocating and educating with regard to the AHEC mission. Perhaps now more than ever, that's super important that we stay in touch with the decision makers to reaffirm what we do and how we serve our communities. The AHEC network is so good to work with from a sort of association um, standpoint. Um, NAO, the National AHEC organization, exists because of the membership dues of the AHECs across the nation. And so we are always appreciative of their support, even as we support them. And so when we put the call out to AHECs to either maybe increase advocacy or to promote, say, National AHEC Week, they're always super responsive, and we just so appreciate that. So we'll be sending out infographics and other materials that the AHECs can use, again, for social media or other media, just to promote among their communities what the AHEC mission is and what we are doing for those communities.
Well, it's good to have that guidance from NAO. And from what I understand, the membership is growing.
It is. We've been fortunate the last few years, been able to provide some resources that help the network, I think, stay closer together, stay in touch in new ways. And so our membership has increased significantly over the last few years. Um, Kudos to Paula Overfelt, a former AHEC Center Director and NAO leader who now is working part-time as a member services manager. And she is just relentless in keeping the network engaged and providing those benefits to our members to make them, the goal is always to make them even better at what they do, or at least give them the resources to accomplish such things, as well as obviously the networking opportunities. So yes, we're very fortunate that the network is getting stronger.
Yeah, I agree. Paula is a huge asset to the organization, and I really enjoy working with her. So, Nicole, can you tell us about what's happening during AHEC week at the regional centers in Vermont?
Yeah, absolutely. So on Wednesday of that week, we are going to be at the State House. It's AHEC Day at the Vermont State House, where we are there primarily to talk to legislators, to thank them for their hard work and for their support, to answer their questions about our organization, but also to hear feedback about what people are hearing and thinking about with regard to health workforce and health disparities in their communities. So if you are in Montpelier, and want to pop in to the card room and say hi, we would love to talk with you. The directors from the centers and some of our team will be present there with materials about the programs that we're running. Um, we are also highlighting Northern Vermont AHEC is highlighting the launch of its pilot EMT training course that's happening in March. So, as we are reaching out to our partners, our media partners, to talk about the EMS shortage in Vermont, which has significantly higher numbers of volunteer staff than the national average, and talking about why it's so important to be training folks in pre-hospital medical skills, um, both as a pathway into careers, but also just to support the public health in rural communities, in places where an ambulance might be 20 minutes away. Individuals and neighbors can save lives if they have these skills. So that is one of the ways that we're talking about strengthening the health workforce is through um, those kinds of clinical skills credentialing trainings. And we're really excited to be an EMT training provider now. And we're also holding stakeholder meetings in the Northeast Kingdom of Vermont, which is the rural 3 counties where our office is located, to talk about supporting adults, creating programs that will be on ramps into entry-level positions in hospitals and healthcare centers and visiting nurse associations and home healthcare agencies and assisted living facilities to try and support the the cultivation of workforce in all different functions, but primarily around nursing, because there are so many employer-hosted nursing apprenticeships and pipeline programs that people can have access to, and just trying to open the doors to folks, support their academic foundations to prepare them to succeed in those careers and take advantage of those tremendous opportunities that are happening right now. And Peg, you've been a tremendous inspiration for us. We're following your lead in many respects. This podcast is one example of the way that you're elevating people's awareness of AHEC in Vermont during National AHEC Awareness Week. So I'm incredibly grateful to you and the rest of the team at Southern Vermont AHEC for leading that charge.
Well, thank you very much, Nicole. And I know that in Southern Vermont, I know our relationships with the schools is very, very important. And I know we've got boots on the ground with our staff, our director of health careers exploration, going into the schools, middle schools, high schools, doing college fairs, just getting the students excited about the possibilities of what's available to them in healthcare. And we're lucky to have such a great partnership with our friends in Northern Vermont. I think we all work together quite well. And I know the demand for healthcare professionals has been a major concern for a while, especially in underserved and economically vulnerable regions. How critical is the need for healthcare professionals now? And I know you've touched on that briefly. But do you see this demand continuing to grow? And so I ask that both of you respond, and anybody can go first.
Sure, I'll respond briefly from just a more global perspective, Peg, but very much look forward to Nicole's feedback as well in terms of what she may be seeing in her particular area. But the need is acute. It's acute now, and the data tells us that the demand is likely to grow. So, it's a situation where more than 80 million people in the US currently live in areas that do not have sufficient access to a primary care physician. The AMA estimates that we'll have a shortage of up to 124,000 physicians by 2033. And of course, that's sort of exacerbated in rural and more underserved areas. So the problem is it's abiding. Our population is aging, our workforce is aging. The AMA also says that nearly half of all practicing physicians today are over 55. So there's no danger of the demand decreasing. When I read these statistics kind of year after year, it just kind of reinforces to me that we at AHEC, we have our work cut out for us. But very interested to know, to get Nicole's take on this question.
In Vermont, that aging and retiring workforce is the need that we anticipate in the future is amplified by an aging and retiring population. So Vermont is sort of an aging state. And so the demand for future workforce is going to be driven by the demand for healthcare services as well. Nursing shortages are a real topic of conversation, and people talk about it as a crisis. And I have actually just come to think of it instead as an opportunity. What I've seen is in the nursing apprenticeship programs that have opened up, the nursing pipelines that are being supported by hospitals and other healthcare employers, in-house training that is taking place to produce more licensed nursing assistants. There are these opportunities for Vermonters to enter a health career with really lucrative career pathways and career ladders that they can follow that are more so than ever before being supported by employers at low cost to the individual. And so directing young Vermonters and mid-career changers into these pathways, and not just in nursing either, but medical lab science and diagnostic imaging, medical reception, medical assisting, dental assisting. A lot of these roles that are can be trained on the job, or that folks can acquire credentials for in under 2 years. These are great entry points for career ladders. And in rural communities, we really have to optimize the contribution of our rural workforce. And I think AHECs are perfectly positioned, sort of like we said before, at that intersection of healthcare and education and community development, to bring together the partners to really support people to succeed who want to enter a health career, but maybe didn't go into college after high school, or didn't feel like that was an avenue that was open to them. There are all of these pathways that are available now. So the crisis that we've been talking about is creating these opportunities because people are innovating, thinking differently about how to fill these positions, how to train folks up, and how to promote individuals to fill subsequently higher positions in both clinical and non-clinical tracks in healthcare.
Dwain, did you have anything you wanted to add to that?
Well, you were talking about sort of career laddering, Nicole, and creative ways, innovative ways to sort of facilitate this transitioning, beyond just getting the entryway into healthcare. I actually was at a clinic not too long ago, and was being treated by a nurse practitioner. And me being me and doing what I do, of course, I asked her sort of about her pathway to where she is today. And she was a nurse, and went went back to school and went through the process. Eventually, became a nurse practitioner. But I asked her what what stood in your way as you were thinking about making this transition to becoming a nurse practitioner. And she said, sort of, it was it was sort of this intangible space of not having information that she needed, knowing what to apply for, testing.
Mm-hmm.
She talked about the multiple steps in the admission and licensing process, and she just expressed that knowing more about the big picture of that process and with all the steps involved at the beginning of the journey would have been helpful. And that was affirming to me because, boy, that's a sort of a gap that is ready made for AHECs to step into, and they're doing that, just providing um, information and resources and networking at multiple points, not just interacting with the younger kids, but along that healthcare career continuum, offering those resources and connections that could be the difference in a nurse deciding to go ahead and pursue his or her their dream, or maybe being discouraged just at not having the information that they need and not having time to go seek it. And then you can just imagine the difference in that one person's life of fulfilling their potential, um, versus sort of not. And then that not only helps them, but it helps their healthcare organization they might work for, and definitely helps by extension, to improve the health of their communities.
Yeah. I totally agree with you, Dwain. I think you're right. Breaking down these barriers is essential. It's not about wanting to do it, but being able to do it in kind of a seamless way. And one of the things I've learned in my role with AHEC is the storytelling. People, their stories are so rich and so interesting about why they decided to pursue a career in health and what got them there. And they're diverse. They're just fascinating, and none of them are the same. And so I've learned. For me, it's just been a wonderful learning experience. When it comes to inspiring, and this is probably to Nicole, but Dwain, obviously, I want you to weigh in too. When it comes to inspiring young people and to pursue careers in healthcare, what do you think regional AHEC organizations can do to motivate the next generation? And what are some of the biggest barriers, and we've already touched on this, young people face in entering the healthcare field? And how can AHECs help them?
Yeah, I definitely think, as Dwain said, that the knowledge, awareness of not only the pathways, but also the resources that are available to young students is a critical barrier. Because of AHEC's generous funding from the Health Resources Services Administration at the federal level and our state and our community hospitals, we are able to provide no and low cost enrichment programs and career exploration programs to students who are rural, first generation, who may not see themselves as quote unquote college material, and or they may not have um, individuals in their social networks, in their familial networks, who can guide and direct them on a higher education pathway. So I think that's a crucial role that AHEC plays. I've also come to really appreciate the value of introducing students to each other in these learning communities. For example, we do a program, we partner with the Governor's Institutes of Vermont in the summer to bring students together for a residential health science enrichment and career exploration program. And I think that there is, especially for adolescents, there's a tremendous value in connecting to other people their age who affirm their aspirations, and with adults who can mirror to them an identity as a healthcare professional or as a STEM professional. We engage medical students to act as mentors to students, to high school participants during these summer enrichment programs. And the value of being able to be affirmed in their aspirations and also seen as someone who is capable of pursuing that pathway is incredibly powerful, and incredibly motivating for students. And we hear about it in their evaluations year after year after year. And we've actually tailored our programs to try and amplify that effect. The third and other important thing, I think, is giving individuals the opportunity to actually see the workplaces and the skills to put their hands on the materials and the tools, and to really try on, I'm making air quotes, to try on the role of being a healthcare professional to see if it's a good fit for them. I think when a student comes through our program and says, maybe I don't want to be a clinician, but maybe I want to be a health IT specialist, that's still a win, because we really want to connect young people with pathways that they are going to be able to sustain and that light up an enduring passion for them. So having that opportunity to see, touch, feel, smell, experience success in um, both scenarios and healthcare workplaces, I think is a tremendous help to students in forging their own way forward.
All right. Dwayne, did you want to add anything?
I would if there was anything to add to that, Nicole. That's such a great answer to that question, and so well said in terms of you sort of dug a little deeper into the just the idea of support, right? And that self-efficacy and needing the network, needing that encouragement and that being able to visualize themselves in these roles that they may aspire to. So well said. I can't think of anything to add to that. I would just say that some form of what Nicole described is going on at AHECs across the nation. Again, tailored to their communities, but that is the kind of work that we do. And as Nicole described, is really something that I take pride in.
All right. Excellent. So, looking ahead, what do you both think the future holds for AHECs? Do you believe the AHEC model will continue to be effective in 25 years? Or will we see changes in the structure and mission? So,
Sure, Peg. I'm not really seeing any indication of any fundamental changes that may be on the way to the AHEC mission. Um, I think what we do will always be needed for sort of, I guess, geographic and structural reasons, rural areas and other areas that are underserved. I think they're likely always going to face these challenges with having enough supply of healthcare workforce to meet the demand. So it's not, someone said recently, they put it so well, and I can't remember the individual's name, but they described AHEC as not something that you sort of get set up and then everything gets better and you move on to the next project. You've got to have some group that's really focusing on that mission in an ongoing way. And so for those reasons, I mean, methodologies may change. Um, NAO put together a project involving virtual reality headsets as a way um, demonstrate health careers to kids in really, really rural areas who may not be able to get to a live sort of simulation event. And then AHECs across the nation are engaging in similar adapting to technology. So the way in which we do things may change, of course, and evolve over time, but I think the fundamentals are in place, and don't see any change in a sort of fundamental way anytime soon, but who knows?
All right. Nicole?
Yeah, I agree completely. Just to add to that, I think as technology continues to surge ahead and healthcare technology advances, the kinds of technical skills that will be required in healthcare workplaces is going to become more and more specific. And so training and education programs will continue to change and evolve, and will continue to need these on-ramps for folks to find the programs that are a good fit for them, to explore the possibilities so they know where they want to aim for. But I think that's a really fundamental role of AHEC. I also think that being a connector for individuals to find and land in rural and underserved communities is really, really important. AHEC is kind of a beacon. People who know, and we sometimes get calls out of the blue from individuals who are looking to relocate from other states. And they reach out and say, "Hey, can you tell me, how to find a preceptor, how to find, you know, an opening, how to connect to, this individual or that individual at this organization." Rural Vermont is a really desirable place to live for the right person. It's not for everybody. Some people want to live in a city, but gosh, I don't want to live anywhere else. And I know that the people who practice here tend to stay here. What I heard one hospital CEO tell me is that if they recruit a physician who's here for more than 12 months, they can count on them to be here for more than 10 years. So finding that connection, again, connecting an individual's passion and preferences with a need, is a great role that AHEC can continue to play. And because our rural communities are great places to work and live.
Well, I don't disagree with you there, Nicole, as someone who's grown up in Vermont and lived here all my life. I'm with you on that. We're at the end of our show, which is disappointing because I could go on and talk about this forever. It's been so interesting. And I want to thank you both for such a rich discussion about AHEC and its ongoing impact on the future of health workforce development. It's been a pleasure having you both on the show. For all of you listening, you can find our podcast on Spotify, Apple, Google, and Audible. Just search for Southern Vermont Area Health Education Center, and you'll be able to tune in wherever you are. I also ask that you please like our podcast and comment if you desire. We can't wait to have you back with us soon. Until then, take care and keep the conversation going.
Thank you, Peg.
Thank you, Peg. Happy National AHEC Week.